Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Monday Health Minutes with Valley Health. Pediatric eating disorders, it's a growing concern that can have long-term physical and mental health consequences on down the road. So today we're talking with Dr. Misty Strau about how do we identify this and what help there is for our kids. Thanks for being here.
You're welcome. Thanks for having me. So I would say the first symptoms that we see are weight loss, maybe some irritability. You might notice that your child doesn't eat dinner as well. They may not be growing like you think they should grow. And then I think you should go in and see your doctor.
I think parents are surprised to think my kid can have an eating disorder, but there are 5 or 6 different kinds, several different kinds that parents should consider. Can we talk about what those are and what they look like?
Sure. So there are many different kinds. Some people are familiar with the primary kind, which is anorexia, which is the refusal to eat foods based on poor self-image or believing that you're overweight or that you are going to become overweight. Then there's bulimia, where you may vomit food after you eat it. And then we often also see binge eating or avoidant and restrictive food intake disorder, which is extreme picky eating.
That's very common in a lot of kids, so it's hard to determine what is an eating disorder and what is picky eater. What is the fine line on that? When do you swing more towards this is really a problem that could have long-term consequences?
Correct. So I think with the extreme picky eaters, they really limit themselves to just a few foods. So they may only eat mashed potatoes and mac and cheese, or they may stick to just dairy products. They really limit all things, versus picky eaters may eat from a variety of foods but are selective about what those foods really are.
So what kind of complications are we looking at when you have a child who has an eating disorder?
So I think with extreme eating disorders like anorexia, the complications can be severe. You can have dehydration, you can have mineral and vitamin deficiencies, you can end up in the hospital because it can affect your whole body, even your heart and your kidneys and things. But I think on the picky end, it might just be that you need some feeding therapy and some nutritional additives in the form of maybe protein shakes, in the form of protein shakes or a multivitamin.
And that can maybe help get your child back on the right track.
Correct.
Nutritionally. Is there anything that a parent can do to prevent your child from having an eating disorder? How can you help them have I guess, not that stress on them to think that they need to control their food in that way?
Oh, absolutely. I feel that eating disorders, preventing them starts at home. So as a parent, your example to how you believe about your body and your health is primary for these children to learn how to feel about their bodies. So, be positive about yourself, and that will affect your children. I think also limiting their exposure to social media will help in this day and age, because I feel like social media really promotes thinness, and there's a lot of dietary guidance that may not be medical on social media that children can have access to, that I feel like we need to limit because it affects how they think about themselves.
Yeah, and try to have that conversation with your child. They can be sneaky, though. I mean, you might think that they're eating just fine, and then it's a while that you realize maybe they're not eating some of the meals because they're not with you all the time. They might be at school and skipping.
That is correct. I do see that quite often, especially in teenagers, that, they'll sneak out of the house before school, they don't eat breakfast, and then they won't eat lunch and not tell their parents, or they might say, oh, the lunch was terrible, and then they'll pick around at dinner. They may, not eat as much, or they may avoid food events and things like that. So I think being a parent, you have to be on the lookout for those things, especially if you're concerned and you see that your child is losing weight.
And what kind of support is there out there for parents who think, yeah, this is definitely a challenge for my family?
Oh, I think there's a lot of support. I think starting with your primary care provider is the #1 thing to do if you're worried, because maybe the child does need a medical workup. Maybe there is something going on with them metabolically that could be causing weight loss, and I feel like that's important to rule those things out. And then I think it's also important, if they do have an eating disorder, to get, the appropriate mental health, help. I think that there's therapy for that, like we had talked about earlier. There's also, feeding therapy and things. And we've seen, a great deal of success in our clinic helping children who have eating disorders.
Yeah.
There is hope.
There is hope. There is help. We have to start asking the right questions.
Correct.
Yes. All right. Dr. Stroud, thank you so much for being here.
You're welcome. Thank you.
Thanks for being here for Monday Health Minutes.